All right. So I'm going to actually just start with some basic definitions. Maybe if my screen will let me turn. There we will. There we go. So I usually actually do a lot more definitions than this at the beginning of a presentation because I want to make sure everybody's on the same page. But from a timing piece, and because the really important part is the discussion tonight, just some terminology that we're going to use, and again, making sure it's clear. And then from that point, if there needs to be more explanation later on, I'm happy to do that. But the first two pieces to just make sure everybody's on the same page with is sex assigned at birth and gender identity, and knowing that these are two different aspects. These are two different pieces of a person. So our sex assigned at birth refers to our basically our reproductive organs, and specifically our reproductive organs that are visible at birth most often, unless there's additional testing that's been done. And we have three different sexes that we can be assigned: male, female, and intersex. And it's also very important to remember that intersex aspect, which is a person who has both female and male qualities, whether it's genitalia, whether it's chromosomes, or anything from that perspective. But it's truly back to that our physiological makeup. Now, gender identity is how we feel. It's how our brain identifies and how we relate as a person. And there is a vast number of gender identities. It's on a spectrum, ranging kind of either end of the spectrum being woman and man, but also identities in many identities in between, being non-binary, where somebody maybe doesn't identify as either. Gender fluid, where maybe that sometimes they feel more masculine, sometimes they feel more feminine. And even within the spectrum of men and women, we see people, again, it's a spectrum, being at different points in that part. So usually I also talk about some additional or additional identities we see, but there are a lot. And again, something we can discuss if people want some more information on those. But again, talking about those two first, just understanding that they truly are two different things. And that's a huge pushback we're seeing right now, where people are like, nope, you can only be a boy or a girl, and that's it. And there's absolutely no truth to that. And in fact, and as evidence-based practitioners, as athletic trainers, the evidence for this came out, actually, a lot of the evidence came out in the 1980s and 1990s. So it has actually been around for a long time. And when you look at history, there's evidence of this much before that as well, but like solid, like scientific, concrete evidence behind it. And at this point in time, every major medical association in the United States and numerous medical associations throughout the world recognize this and support this concept. It's not even a concept, this fact that sex assigned at birth and gender identity are two different things. From that perspective, then, when we hear the terms transgender or cisgender, so transgender relates to any person whose gender identity does not align with their sex assigned at birth. And that can be in a variety of ways. But if their gender identity does not align with their sex assigned at birth, then they can identify as transgender. And for somebody who is cisgender, it is somebody whose gender identity does align with their sex assigned at birth. So a lot of times you'll hear that shortened, and I may even shorten it tonight to trans individuals or cis individuals. But that's the terminology there. And then the last term I'm going to define from our beginning is gender affirming care. And this is a huge piece for us as healthcare professionals, understanding what it is. And once again, there's a big misconception, because that term is now out there. It's out there in the news, it's out there in the public. But really the way that it's being used there is a lot of times just looking at surgeries and things like that. And when you actually look at the definition of gender affirming care, it is any healthcare, any care that encompasses a range of social, psychological, behavioral, and medical interventions designed to support and affirm an individual's gender identity. So when we actually look at what gender affirming care is, it's much bigger than just surgery, than just hormones. There's a lot more components to that. And we have to keep that in mind as those topics are brought up. Now, to take that kind of one step further, and something I'm sure we'll probably talk about a little bit more, is what kind of gender affirming care is, and the different pieces to that. Now, without going into a whole lecture, one of the biggest proponents, as we're looking at most of the legislation, and what we're going to look at, is, should especially children and youth be able to get gender affirming care? And that's a huge push that we're seeing, where we're seeing a lot of states saying they can't. And so what, again, what does that mean? What are they limiting? And they're limiting more than these two things that I have on the slide, but these seem to be the two things that are focused in most of the laws. So the first thing is, a lot of them, when we look at hormone treatments for gender affirming care, the idea that we hear out from everybody is, well, kids can't make these decisions. They're mutilating their bodies. They're changing things about their bodies. They don't have the knowledge or the understanding to know what they're doing. They're going to change their mind later on, right? These are all kind of what we're hearing from people, which is, none of that is factually true at all. In fact, most of it is the opposite of the truth. So the two biggest pushbacks are hormone therapies and specific puberty blockers, where from a hormone piece for a child that may start hormone therapy, that we actually suppress puberty before doing a hormone therapy regimen that would be maybe different hormones from their sex assigned than you would anticipate from their sex assigned at birth. Again, we look at age. People always argue how young this should be. So just to be really clear on a couple of things, puberty blockers will never be prescribed to a person who has not entered Tanner stage 2. And while we probably all heard of that, that's not the number one thing that we as athletic trainers utilize. So just as a reminder for Tanner stage 2, that is the beginning of puberty. That is the very first signs of puberty that we see. So prior to that, nobody will ever be assigned puberty blockers because of their gender identity. Now, when we look at the ages, the average age of females to reach Tanner stage 2 is 10.9 years old, and the average age of males to reach Tanner stage 2 is 11.5 years old. So that's the age range that we're looking at, where really the first actual interventions are being utilized, besides maybe some mental health care, some support systems, and things to that effect. Also, really important to note, puberty blockers are 100% reversible. When children are put onto puberty blockers, at some point they'll have to make a decision to go off and potentially onto hormones or to stop the puberty blockers. If at any point they choose to stop puberty blockers, essentially what happens is they go through puberty. So then they would go through puberty as their sex assigned at birth. So nothing that has happened up to that time would be permanent at that point in time. Everything is reversible. The other fight we always hear is about surgeries. And again, that's, where people are saying, well, we can't have these surgeries. One, where this is an argument, is they are rarely performed in minors. It is not something that we see often. In fact, in our country, yearly, on a regular basis, there are more rhinoplasties and breast augmentations performed just based on desire, like through plastic surgery, for adolescents, for people under the age of 18, than we see gender affirming care type surgeries performed. Yet nobody seems to be up in arms about those, and those children can make their own decision about that, and everybody's okay with that. But if it's because of a gender identity piece, that's where people are pushing back. So we're not seeing that. And if somebody is having surgery, because again, gender affirming care surgeries can look a lot of different ways. A lot of people look at the really major surgeries, where you're looking at the external genitalia, how that presents things to that. But a gender affirming care surgery could be a partial hysterectomy in a trans man. So there's also a broad range that we're talking about. But if they are getting approved for surgeries, it is a full team approach. They've been working with mental health professionals. They've been working with doctors. They've been going through a process. We know as healthcare providers, nobody just shows up to the doctor and says, I want the surgery. And they say, okay, like that's not how it works, but that's how it's being presented. That's happening. And that's just not true when we look at those pieces. So that was the extra long definition of gender affirming care. But why we're having this conversation, there is just an attack right now on LGBTQ individuals in our country, and specifically trans individuals. And to the point that last Tuesday, the Human Rights Campaign actually declared a national state of emergency because of how significant this is. And they've never done that before. The rhetoric has increased, the laws proposed have drastically increased, and the laws passed have significantly increased. And it is affecting people's lives at the short end, like what we're seeing happen with this. And as we kind of look at the numbers, which I'm going to just introduce to you on the next slides, I just want you to keep in mind that in this country right now, it's estimated that 1.6 million people, but probably a little bit higher than that just because of reporting, that 1.6 million people identify as transgender. That is at most, even if you add, right, that maybe some people haven't reported, 1 to 2% of our population. And the numbers that we're seeing for bills proposed and bills passed attacking are geared towards only one to discriminate essentially against 1 to 2% of our population. And that's why it's such a huge issue. And especially for us as healthcare providers, now it's impacting us as well. So just kind of where we are numbers wise, why this is such a big thing. So it just in this year, so in this almost 6 months that 2023 has been here, there have been over 520 anti-LGBTQ plus bills introduced in state legislatures around the country. More than 90 of those have been targeted specifically to deny or limit gender affirming care in some way. And over 130 of those that have been proposed would impact healthcare in some way. Now, just to give you a little bit of an idea of why now it's a state of an emergency, in 2020, only 79 bills were proposed for anti-LGBTQIA plus bills. In 2021, 147, and in 2022, over 300. So we've seen this constant climb and hit this mark of over 500 at this point in time. Already in these first 6 months, more than 75 of those bills have been passed and enacted. And of those 75 bills, 15 of those have been bills that have banned gender affirming care for youth specifically, and some for adults. So those are the numbers that we're looking at, that it's like on a daily basis, people are proposing anti-trans, anti-LGBTQ bills in our country. So currently, when we look at the states that are banning gender affirming care, this is the current list. So Alabama was one of the first ones to actually ban it. Currently, it's being challenged in court, so it has been enacted, but we're going to see where that goes. Arkansas initially tried to do a ban. It was actually kind of struck down or halted, at least in court. And so this year, then they proposed another law that what it does is it is allowing people to patients to sue doctors up to 15 years past their 18th birthday if they had any sort of gender affirming care. And because of that, no insurance company is going to is providing malpractice insurance to any doctor that will provide gender affirming care. So currently it's not technically illegal in Arkansas, but because the doctors can't get malpractice care if they provide it, they're unable to provide it. So we see these kind of, even if the straightforward bans aren't coming, we're seeing these kind of workaround laws coming into place. Florida is Florida. But the only good news that actually recently came out of Florida is a judge actually has ruled that one of their gender affirming care bans is not able to be, is unconstitutional, and was actually very clearly politically motivated by the wording in it. So we may see some reversals and changes with theirs. I don't need to read every state on this list to you. I included Louisiana because Louisiana is the most current one. Just last week, they passed the Senate. It is at the governor's desk. The governor has voiced that he will actually not sign it. However, they have a supermajority, so it is anticipated that they're going to override his veto once that actually comes through. These states, when you actually look at what these laws are, most of these states ban all gender affirming care. When you read the pieces in it, it specifically calls out hormone therapy, including puberty blockers and surgeries. But also what we're seeing, some of these states also are penalizing physicians. So Idaho is a state where they criminalized providing gender affirming care to minors. North Dakota, if a physician was to perform a gender affirming surgery, it would be considered a felony. If they prescribe puberty blockers, it's considered a misdemeanor. And in other states, you're looking at least fines, removal of licensure, things to that effect, even if it's not criminalized. And then we also see in some states, some of these also are now attacking the families as well. And Texas and Florida both have bills either enacted, and again, with the courts, I don't know, where children whose families support them in getting the care that they need can actually be removed from the homes because they're saying it's essentially child abuse and dangerous to the kids. Now, I didn't point this out earlier as we talked about gender affirming care, but also every major medical association in the United States supports gender affirming care through research, through evidence, says not only is it important and necessary, but it's life-saving. So what we're seeing in these is we're seeing these are all like, all these states are saying it's harmful to the children, but that's actually the opposite. Not providing this care is what's actually harming them. And then when also you see that, well, maybe it's about the children, but several states have proposed, Oklahoma, their minors law passed, but they've also proposed a bill to deny gender affirming care to up to 26-year-olds. And Missouri's bill right now, they proposed that they would also deny all gender affirming care for all adults. That got shot down in court. But they have eliminated all gender affirming care for everybody, all ages, from Medicaid and Medicare. So nobody can get it paid for from that sense. So we're still seeing those pieces. Now here in North Carolina, there are currently, we haven't had any enacted, but there are currently 12 anti-LGBTQ bills proposed and advancing through both the House and the Senate. There are 4, technically 5, but 2 merged together and are the same, that are specific to targeting gender affirming care and prohibiting gender affirming care. All 4 of them specifically name puberty blockers and hormone therapy treatments, as well as surgeries and preventing those. Several of them do require, one of them requires a physician, participates, that they would actually lose their licensure in the state and owe a fine. There's some slight variations, although there's very similar, but there's multiple people proposing them. One I do want to point out on our end, and we'll talk from it, like how this does affect us as athletic trainers, but the Senate Bill 560 limits to gender affirming care. The one maybe good thing in it is that one actually has some exceptions. Like none of it is good, just to be clear, but if it did get passed, there's some exceptions that there's a way people could potentially get this care, but they have to have multiple doctors on board, like multiple steps, and they certainly didn't make it easy for somebody to get the care. But in the wording, when it talks about it's unlawful for any physician or other healthcare provider to provide gender transition procedures, the next line, what it says is, a physician or other healthcare provider shall not refer any individual under 18 years of age to any healthcare provider for gender transition procedures. And I think that's one thing as an athletic trainer, is we kind of, obviously we understand we're healthcare providers and we talk about that all the time. I don't know exactly where things are going to happen or what's, where it's going to fall, but that wording isn't a law that we could fall under. And they made it broad enough for that reason. And what does warrant a referral? Do we say you should go somewhere? What are those different pieces that could specifically impact us? Also in North Carolina, when we look at, I've been focusing on healthcare, but a lot of the anti-trans bills also have to do with athletics. It has to do with educational pieces and all those other aspects. So we have 2 currently in North Carolina, the State Bill 631, or the Senate Bill 631 and House Bill 574, which is the Fairness in Women's Sports Acts, which essentially would prohibit anybody from participating on a sport based on their gender identity. They'd have to participate based on their sex assigned at birth. And then we have the Senate Bill 636, the School Athletic Transparency Act. And this is one that a lot of you, especially if you're a high school athletic trainer, have probably heard about, because it's kind of our current state legislature's way of taking back control of the NCHSAA. Currently, the NCHSAA does have a rule or a policy that trans individuals can participate based on their gender identity if they go through certain processes. It has to be approved. And we do have several trans athletes in this state playing on sports based on their gender identity. And this is kind of again, a backhanded way for the government to come in and say, actually, we want to take control of that now. And one of the things that they've made clear in this bill is that they would change it so all athletes would have to participate based on their sex assigned at birth. So that's what we see here. Other things, just again, in these laws, things that could limit us from using people's pronouns and preferred names, just recognizing them as, humans and what they want to go by and who they want to be called. There are laws out there that are potentially going to force different people, if you are aware of it in your job, to potentially out that person who maybe confidentially talks to you and says that, they may be questioning their gender identity, and you may be forced to reveal it to parents or other people. It's looking at who is, under these confidentiality requirements and what can we do, what can we protect still. There are a couple, not in North Carolina right now, but in other states, where they're requiring different, or trying to require different verifications based on sex assigned at birth. And then the question is, well, who's going to do that? Like, as if we're doing physicals, are we going to be expected to verify based on external genitalia what that is? So that could be something coming down that we have to deal with. And then while these laws are geared towards trans and LGBTQ communities, there's going to have a bigger, profound effect when we actually look at the fallout from that. And obviously the trans individuals, LGBTQ individuals are definitely most at risk when we look at what's happening right now. The last thing I'm going to point out, and then I'm going to stop talking on this end so we can have some discussions about it. There was also a national law proposed this year, our federal bill, House Bill 734, that was presented to ban trans women and girls nationwide from participating in sports based on their gender identity. They also tried to tie it to Title IX, saying they were protecting Title IX by that. Currently, our administration has shot it down and said that it's not going to happen. However, if it's, the willingness again at the national level to see some of these come through, and as administrations change, we could see some additional pieces there. And the last thing in sharing what to me is devastating on kind of a daily basis as we hear about these things, when we're talking about our patients and our athletes and how these are affecting them, is obviously in states where maybe gender affirming care is banned, or it's, there's limitations, it's physically impacting them in some way from being able to get the care that they need. But the other thing we have to remember is just knowing these laws are being presented, that in itself is impacting our patients mentally, definitely from a mental piece, how they feel, how they're validated. To hear local politicians, national politicians stand up and basically say, like, everything that other people and experts have said for you and what's good for you doesn't matter. We don't agree with this. We don't think, to the point we have politicians saying trans people shouldn't exist in this world. They're hearing that. They're hearing that every day. You can't not hear it right now when you turn on any news channel. And then in addition to hearing their politicians say that, they're hearing their family members agree, their community members agree, and people speaking out about who they are at their core. And so we have to remember that, yes, as we're talking about these laws are really hurting and harming our trans patients, but just the sheer discussion of these laws is harming them in some way, even if they're in states where they're not getting passed, even if they're in states where they never will and they still have access to everything they need, there's still some really, really horrible effects from what's going on today with this information. So I'm going to kind of end it there, in the idea that hopefully, I know I introduced a lot of information in a short amount of time, and I'd be happy to even start with answering any questions if there are any, but then bringing up some points we can discuss just in general with this. I do also want to just add, as we have this discussion today, and I know, as Kelly said at the beginning, we'll actually shut off the recording for this piece so people feel comfortable asking. But some of you here today maybe aren't as comfortable or as confident in what we're saying, or understanding why. Maybe you're still, feeling like, you don't have enough information to understand why some of this gender affirming care is okay. And we also want you to feel comfortable, everybody to feel comfortable asking those questions to get further information, because that's really what this is about. So we can continue to educate everybody, and we can learn and grow together. And then through that, we can support all of our patients together. So